Take this tip seriously. It could save your nursing license later. As a nurse, we need to advocate for patient safety, not just the nursing duty that we have. We have a professional and a legal obligation to that patient. So the standard of care requires a nurse to promptly notify the physician. When a significant changes occurs, that's going to impact the patient's outcome. So what are these? This is like a sudden change in vital signs. So are we hypotensive? Are we hypotensive? Are we tachycardic? Are we bradycardic? Are we like hypoxic? Are we looking for air? Vital signs, changes, acute distress. So you want to think the ABCs, airway, breathing, circulation. So where they have chest pain, do they have shortness of breath, do they have a change in mental status? Is there excessive bleeding from somewhere? So those acute, sudden signs of a patient's distress. So the unexpected assessment findings. So when you're going in and that neuro assessment I was talking about, that when you're on one side of the bed and you move to the other side of the bed and the patient's tracking your eyes, so you know neurologically they're intact, but all of a sudden they have a deficit. You stand at the end of the bed. This is where I tell you to do your head-to-toe assessment. You stand at the end of the bed so you're making direct eye contact with the patient, okay? And you start with the feet. We say a head-to-toe assessment, but I kind of like to switch it up a little and say foot to head, because we want to look at the foot of the bed to them. So if they're asymmetrical somewhere, one side of the face is drooping. If you're standing in the corner, you're not really going to be able to see them, especially if you're standing in the doorway. So that's why when you're going in to do your assessments every 2 hours, you're going into the room and you're talking to the patient. Doorway, you're looking if you're running down the hallway, if you're just waving by, hourly checks kind of thing, and you're just kind of going in the room and you're kind of saying hi, and you're looking at them and they're saying hi, they're talking ABCs, we're okay, we can kind of move on, okay? So compliance with surgery and anesthesia. So this is airway issues, because remember, they just had a tube down their throat. They just had anesthesia, so they might not be able to swallow. So we need to do those Yale swallow screens and checking for swallowing at the bedside. One tip I have for that post-op patient, they can't swallow or anything, and you have to give them at least 30 cc's of liquid. So that's a little med cup. But some patients say, I have pain, I can't do it, I'm not sure. This is why we offer ice chips first, because the patient can put it on their tongue and then it melts. And as it's going down their throat, it may give a little tickle and they'll cough. So you'll see that they have issues. So ice chips, then water. Okay, the complications of an infection, one of the things I have that happened to me is, so I try to time out my checks, like I say, my time management and what I'm trying to do. So I work 7 to 3, so my 2 o'clock, when I'm giving 2 o'clock meds, that's when I do my last assessment, going in the room, making eye contact, and talking to the patient. And if they have a wound, so this patient had an abdominal wound. So he had a abdominal laparotomy wound, like from just midline, like epigastric, mid-abdominal area and down. So I can't remember how big it was. It was like 5 inches or something like that. So anyways, when I looked at the dressing in the morning, it was dry and intact. And I was like, okay, I made my change on it. Name, date, and time that you changed it. Remember those 3 things on your wounds that you do it. And when I went back at 2 o'clock to check it, I was like, or I would say noontime, just before lunch, I noticed there was like a little staining. So I marked it out with my pen. So I marked out the stain so I can see if there's changes in it. So my 2 o'clock, I went and I looked at that mark, especially when I'm, like I said, I'm doing, if there's anything I change or whatever, you're looking at it. Anyways, I looked at that stain and it was outside of it. So I said, we're bleeding. Something's going on. So I opened the wound and his insides intestine, he dehisced. I put the call light on, asked for help. I sat there and I'm like, we need to page the doctor right away. And I said, I need sterile saline and an ABD pad. So we go get that. I put it, all of it, I soak it, because remember, we got to keep it wet, and just cover it and keep it sterile until the doctor gets there. Okay, so this is any events that need immediate medical surgical interventions, and that's where you use your judgment and the policies. Follow the policies. Okay, I hope you have a good day.